Same as the spay. So umbilicus, pubis. We're going to do a big incision. I'll get you to grab some swabs if you wouldn't mind. There are going to be vessels here that are big, and it's possibly going to be a bloody affair getting in. Along with those swabs, you wouldn't mind grabbing some clamps, probably 3-4 clamps just from that table. Vessels aren't that bad so far. There's a vessel.
Do you want curved or straight?
Doesn't matter.
Pretty straight.
Good. So just let's grab a clamp. Yep, beautiful. We're probably going to use some more clamps, Rachel. Just be aware if you want to preempt that. So just we're going for these big. It's always going to ooze. If there's.
You need some more?
Yeah, why not?
3 more there.
Probably grab us. Yeah, I'll grab them. Do you want to
grab some more now?
Yeah, let's grab another 10, you know? And you can just open them up. Beautiful. So we're through the skin, now we've got to get through the subcut tissue.
Sorry.
No, it's alright.
Try to expose our linear alba. Have we drawn up more alfaxan?
We haven't drawn it up.
So that's one more thing for us to do after those hemostats. Can you draw up another 5 mils as a preemptive? We're not going to give it yet, but we might as well work that out now. So we get you to put pressure there. Just for a moment, there's going to be a decent vessel which we'll have to clamp. Decent level. Yeah, I'll clamp that one. You dab there again. Look at that. Oh, just keep on holding pressure there. See how it takes a bit to get down. Now we're getting down to where I want to be. And personally, it's better to expose everything now well, which is going to make my suturing up very easy. It's a bit annoying. How are we going for clamps? Do we have yeah.
I've got 6 more here and I gave you 4 already.
Careful, chances are we're going to use a ton, so just be aware. Right, I'm happy that we've exposed everything. Let's clamp up here. Oh, done a bloody good job. All clotted, happy with that. Right, so enter into the abdomen, nice and carefully. Linear alba. This is one of those times where sometimes you do have a uterus effacing the abdominal wall, so you do want to be cautious. This annoying little vessel that right on the umbilicus. You want to put pressure there. Very important, so we're going to have a big incision. So now that we're entering the abdomen, we're going to change over. We're not going to use any, see all those little swabs?
Yeah.
At least for the start, I don't want to have any Little swabs near the abdomen.
Yeah.
We're only going to use lap sponges. You want to take off that. It stopped with bleeding already. You've done a bloody good job.
So just those on now.
Yeah. Only feel free to grab one. Big lap sponges. Good clotting. Cool. Alright, so here's our fancy form, which we'll just move a bit forward. I think we'll try to leave it. Not try to cause too much more bleeding. So the uterus in a big dog's delicate. We don't know how many there's going to be, but we just got to be very cautious. There you go, I'm going to hold that one. This looks good. I think we'll try to exteriorize the entirety of the uterus because I think that's doable in this patient. That's great. So it's not massive, not heaps of puppies. Isolate this up. My guess was 4 to 5, and I think it could end up being like that. Good. Let's do that. So, let's try our best. All fluid to go down. Do you want to move that light so it's more situated here? Yeah. There you go, that's perfect. And we'll go here. We're looking around trying to see an area that doesn't have too much blood vessels in it. It all looks like it's got a fair bit of blood vessels in it. We'll go through. Careful that we're not going to cut down onto a puppy. Really delicate. Again, watch the fluids if you need to kind of push down on it to get it to flow where it needs to flow. Try to get it to flow that way. Exteriorize the puppy, we flip it on the dashboard. Do you want to hold it there?
It's smaller than I was expecting.
Yeah.
Cute. Kind of look like the bulldogs from.
Yeah, it was not the colour I was expecting.
Interesting marking.
Yeah. So one ligature goes on the puppy side. We've got a clamp on the mum side. Cut on through. Mayos. So very important, you want to bring that to us, that tray a little bit. How we do it is we pick up the puppy, we go straight onto that and we drop it. Does that make sense?
Yep.
We try not to make too much of a mess between here and there. And now it's just rinse and repeat. Find a bag, rake the bag. This one doesn't want to come out. Come on. Like a carving over on its legs. Have you guys done much carvings yet? No. Come on. That's a lot bigger than the last. There you go.
Do you want to start rubbing the next one?
Good. Any concerns whatsoever, Rachel, just grab Ash, particularly when it comes to resussing pups. Good.
How long should it take?
Grab Ash, she'll give you a demo. It's the easiest thing for you to do. Sometimes it takes... Yeah. Sometimes so all it is rubbing very vigorously, harder than you think, holding the puppy in a downwards direction, very vigorously on the dorsum, firm strokes. Yep. So pick this one up, just as before, try not to drip anything. And you drop it without touching it, perfect. Move on to the next one.
Excuse me, without a breath.
Mm.
Oh, there you go. Okay.
Maybe I'll demo on this one if I can get it out.
Oh, hey. Oh, hey.
There you go, that's a noise.
Thank goodness.
Some puppies will come out and they'll literally be screaming and biting your hand. Some will take a bit of time.
You hold them down to promote getting the fluid out of the...
Yeah, exactly right. The goals these days is less about try not to shake the puppies.
Yeah.
But we do firmly, very firmly
Funny. My boy's alive.
Yes.
Oh, but David, where do you want me to put them?
coming out of you.
This is not easy.
Where do you want them to go?
A cage or a box, Jeremy, do you want to do something there? I seem to have made my incision, sadly, in not a great spot where there's a bit of a restriction. So I need to get him out by here, but I'm just struggling. There we go. There we go. Oh. Good.
Oh gosh, so much food coming out of you. Little girl.
So if I was to demo it, and again, the best people to speak to when it comes to resuscitating puppies are nurses, not vets. But essentially, having the towel, grabbing the towel here, head down, vigorously rubbing on the back, again and again, and vigorously, long strokes, hard. Pop this one here. Again, grab Ash, you should be free now. She'll help you over. If not, grab another person. So we're going to remove these placentas now. So what do? We just grab a placenta and we gently pull.
And just try to separate the zonary attachment.
Yeah. Nice and gentle. Maybe I'll leave that there. I've been doing this thing, which I don't know, where I remove them after I give Syntocin. I wonder if that helps. Do another incision here.
Oh hey. You were quick.
Good. Again, direct that fluid down. Jab in. Just a little bleeder. Do you want to pop your hand just there? Yeah, I'll grab a. Nice.
Two left.
Right. So, this is going to be interesting. I'll let go there for a moment. I'll flip up.
So blue.
Sadly, this one's not for living. So this is all the intestines that are on the outside of the body. So this one is not viable, which is not good. But there's nothing we can do about it, and there's certainly no surgery. Very brave person to try to fix that. Straight away, we're going to euthanize this puppy.
Just to bleed the bone.
Yeah.
I'm thinking.
It hasn't developed normally. To have the intestines where it should be.
That is odd.
It's not common.
It's really.
Euthanize.
Can you
Take to Jeremy.
take to Jeremy, or again, if when Ash is off the phone, can I have a word with her, please? So just remove this.
that the last one? Or is it another one?
We'll have a look. I think that may be the last one. This is gentle traction.
So is the zonary part similar to like a cotyledon in the fact that it's interdigitated, or and that's why it slowly pulls apart, or?
To be honest, I don't know enough details. Like I would have known that at some stage. I think cotyledons are very good that they do set like there's a very distinct, and it could be completely wrong, but a completely distinct separation between maternal and baby.
Yeah.
I think dogs there is a separation, but as you said, it's in the zone.
That's
Yeah,
the last one.
I think that's the last one. Yes. Versus, and I could be very wrong. I think in human, which is the animal where it integrates?
Horses.
Horses.
Horses is diffused, so it's all throughout the creature.
Yeah.
And then I think we have like primates have like a single location of adherence, maybe.
Interesting.
I think pigs also have diffuse, but they have the multiple zonary diffuse.
Rachel, could we give syntocin, please? So bleeding is very normal when removing them. Syntocin helps because it shrinks down the uterus, so let's give that straight away. Sometimes you can have too much bleeding, but...
Oh yes, how much do you want?
0.2, 0.5. I've already drawn it up, Rachel, if you find the tray.
Sorry. That's fine.
Hello, Ash. I just wanted to check. So we've got one puppy out there. Jeremy may be euthanizing it. If not, it needs to be euthanized.
She's back if we need to talk to her.
No, we don't. It's a 100% decision that needs to be made.
Just
not
one?
not for saving.
Okay.
Just 1.5 IV.
Yep.
The placenta is coming away well, which would suggest that we're not too early, which is good.
Did you need any more clamps?
I think we're actually pretty good now. Like, thankfully there actually wasn't that many babies in here, so
Yeah.
as far as mess goes,
Is that because it's a first time amazing bitch?
just the way it rolls sometimes you get lots. Big dogs normally do have a lot. So we have a good feel, and we're going to make sure so no babies in there, 100% sure. Ovary, good. Now we just got to suture up and we're done.
Because it's like a soft tissue, would you use a round body needle?
In an ideal world, 100% you would. Again, this, if you're talking about the textbook answer, yeah. Anything internal, round body goes well. We have some more lap sponges, please. Having said that, I have reverse cutting, and reverse cutting will work just as. It's not going to give us any grief.
This is the last one.
Cool.
And it's like reusable.
Oh, no, not that one. Maybe we're out.
I don't know if there's any more then.
That's all right. Now I have to fight the blood on its way out, which is annoying. Let's see how we go. Just like the other day, we're going to do a Utrecht suture. You wouldn't mind intermittently just dabbing for me?
I'll wait till you're readjusting on the line. So what was the type of suture you're doing?
Utrecht. It's just the most... It's a very common cow suture. It's just one way of closing.
So what's the difference between that and like a simple surgeon suture or cruciate or...
That's what it is. So it's simple continuous. You're going in 45 degrees to the incision, and I believe, and I could be wrong, it's full thickness. So it's just a way of inverting the tissues in a single layer.
Also, it's from outside in.
Yep.
Do you want to have a methadone now?
How's she going? Can you give us a heart rate, respiratory rate? I think she's nice and stable.
Yeah, she is. Oh,
Thanks, Jeremy. I'd love some more.
I'll have to check with her vet.
Rachel and the girls look.
What did you say about me? Where were they?
I don't know where they are.
Alright,
Oh.
Right.
Heart rate's at 80.
Yep. Wouldn't mind one hand kind of pulling, maybe that hand there.
Yep.
You wouldn't mind reaching over and just pulling this way.
Breast rate's 24.
Yeah.
Her colour's good. The refill time's good. She's at a good depth. The SpO2 was good like a couple minutes ago. It was like 99, and it's just turned off
Okay. Alright, give the methadone IV. That was the last one.
Just quickly tell that.
Yeah.
Lazy puppies.
Working up well. How many did we end up with?
now.
3, 4 with
The euthanasia.
the euthanasia.
2 girls. I had 2 girls. Girls and a boy.
Nice. Just dab there again. You don't mind redirecting that light again, Rachel?
Oh yeah.
So it's now kind of in the middle. Please.
Is that better?
Yeah.
Done
Yep.
before you do.
Go for it. And close her up. Good. Get a little bit of a clean down. On to this next one. The uterus has shrunk down really well, which is good. How are things going, Ash?
Good. Get there. Got a few things on the back.
Who had Bridget's horse? Yeah. What?
I'm just going to do this one 2-layer closing just purely because the angle was to do a U-track, I'd have to be lurching over.
Yeah, it's like that if it works.
No, that's good.
Like, they do like charging for it. Trying to go in.
want to tell her about that pup?
I will afterwards, I reckon.
So she's going to ask.
Absolutely. That's fine.
Where are we going to recover that?
Probably on the ground, to be honest. Too big for one of our cages. If we can find a cage, we'll go on a cage.
I don't think she'll fit in one.
No.
I don't think she's going to be getting up in the morning anyway.
So this is another way of closure. So just a double layer, simple continuous, and just fold it up with a pushings. And on back up. Both very valid ways of doing stuff. Right, so everything's closed.
Yep.
Get that. Let's have a careful look. So we're happy that there's no other babies in there, which is good. Happy that everything's been closed down. I think everything's nice and clean, which is very good. No swabs that we're going to drag into the abdomen. Pop back in carefully. Very good. Get that all wiped down. And we'll begin by ligating some of these vessels, and we'll be starting to close. Any questions at this stage?
Not really.
No, alright. Let's ligate some of these vessels.
Do you want the second lot with syntocin, or is she fine?
Might as well give another one.
Is that the bladder?
Yeah.
Is it big?
No.
No. I was just making sure I was seeing the right things.
Just poking its head out. Happens when you got a big incision.
Yeah. We had an interesting X-lap where we opened it up and the entire omentum had solidified.
Solidified.
Like it had gone. I think it was. We think it was like a neoplasm up.
No, I
A
see.
cancer of some sort, but it was all just like basically like when you press on like a really firm like lump or something, the entire momentum had gone like that throughout the abdomen.
That's definitely not normal. I don't think I've ever seen that. Rachel.
Yes, as soon as I looked up, I was like, wait, no.
Is that good?
Yeah, it's better. We're gonna have a look on that bench there, Nathan, to see if there's another 3-0. If not, we have another 3-0.
I've just put the babies on that side back there.
Just around it there.
We have another 3-0, please.
Yeah, or just some.
Yeah, we need another one. Reg.
Thank you. So I'm ligating these, which we're nearly done. Just pull off the clamp and pop it on the table, please.
Mm-hmm.
And hold that one up just like that. Good. Here, there. I'll get you to. I'll get rid of that.
Still there. It's, oh my god.
Yep, good. Just a long ass hair. Make sure it's gone. Good.
Yeah. And I put the Tamgesic into the estate book as well.
Yep. For both?
Yeah. For honey and coddy.
Okay.
I'm gonna ditch that clamp. I'm just gonna hold that one off a bit. Do you want to take that clamp off?
Yep.
Yeah, just struggle a bit, but yeah, good work.
Try to do it left-handed sometimes. Click it the wrong way.
Good. One more to go. Sorry to ask you to do it, Rachel, but you wouldn't mind dabbing my head if you grab some.
Swabs.
Yeah.
Yeah, that's fine.
Yeah, you get to take that one off. Right. Just for 1 second, Rachel.
No, you're fine.
Cool, go for it. Appreciate it.
That's right.
Right. So let us begin our closure. This is with our big old suture material.
The 2-0.
Yeah. The two.
Up to.
Alright. Should hold that. It's on a taper needle, so it gets a bit annoying, but we'll see how we go. Try that. She's starting the wrong way. I normally start this way. You wouldn't mind putting one hand. Which way do I normally start? Yeah, there. No, I'm gonna start this way.
Sorry, I've got myself tangled in the line of that.
That's right. Very important that we want to make sure we get all the way to the tip of the incision.
Yep.
We're going to be doing buddy suturing, so essentially I'm going to get you to hold the suture,
Mm-hmm.
and every 2 or 3 I'll pull through. And hold that suture there. Squeeze in, let go there.
Yep.
This tape needle is going to annoy me. Probably every 2, so I'll pull through. I'll get you just to hold that there, just to keep some tension on it as we go. Nope. Keep that tension just there. Good. So keep the tension and we transition it through. Good. So as I pull on this one, you slowly come down with it, and you hold that tension until the last moment, so come down with it, then you let go and you grab the new one. Perfect. Have you done much cow seizures?
I haven't seen a single cow surgery, full stop.
When do you do those pracs?
Must be next year.
I think it's fine.
All,
Yeah.
yeah, all of our surgery starts next year. Or from next year at least, so. But yeah.
Yep, so keep the tension to the last moment, and then, yeah.
You made minimal mess as well.
Mm-hmm.
You made minimal mess.
Mm.
Very impressed.
Sadly not perfect, I could see some blood splatter.
Oh, it's alright.
Yeah.
I know.
Puppy's recovered.
Minimal was used, not none.
It's true. The puppies have recovered well.
Yeah. They're nice and pink now and they're screaming the other ones off.
Yeah.
Ash put them on heat packs so they're nice and warm.
Yeah. Yeah.
So you don't wash them fast yet.
Nice.
Yeah, I've mostly only seen small animal stuff. Just when I've been working in clinic.
Yep.
Scrubbed in for some cruciates and TPLOs, TPLAs,
Nice.
like that, which has been very interesting.
That'll be fun. That'll be very fun. See how important it is to be able to see what that linear, that external rectus sheath is.
Yeah,
So it does all become bloody mush. It does get harder.
Yeah, especially with that big fat layer in between.
Yeah. Yeah.
Surgical instruments in sterilisation, Dave?
Yes, please.
Have your bladder's hanging out. What are you doing?
I'm gonna poke it in a moment.
Hey,
How's your day been?
that's a big X-lap.
To be honest, I thought I was gonna need it. Turned out, not so many babies.
Caesar.
Caesar. 4 babies.
I opened it from your old arsehole.
You know it, Shabba.
Big dog.
Huge.
Right.
Yep. There you go. Put that one in.
They look like it though.
Do you do many GDV surgeries and stuff?
Oh, I wouldn't say many, like.
But you do them if they come in?
Yeah.
Yeah.
I think most general practices would. Pretty straightforward.
Yeah.
Procedure?
The clinic I work at doesn't tend to, but that's because we literally have an emergency 2 doors down.
Yeah.
So yeah, they tend to refer just to there.
Which makes a lot of sense. There you go. We do. The standard size ones we would do would be just German Shepherds.
Yep.
But I wouldn't say that they're common in any way, shape or form.
Yeah.
Yep. There Yeah. That's right.
That's alright. Next to that glove, I'll swap to my other hand or something.
Nice. Feel free, swap some gloves afterwards. We'll finish the line, then you can swap gloves. Yeah. So the last one. Good work. Yeah, all good. We change over some gloves for
7.5, please.
Nathan, please. Don't mind clicking some of those yeah, feet down the tables.
Down.
Yeah, that will just lock it in place. If you could hit another one down as well, that would be good.
Do you want any on the other side?
Nah. Just need to have some down and that'll be enough. I'm grabbing some swabs.
Yep.
The swab there. And then same thing, you're going to hold that. I'm just going to do some buddy suturing. Every 2 to 3 we'll go down, take a little bite of that linear rubber.
Mm-hmm.
Remove some dead space. Flip that one out of the way.
Does that make future Caesareans more difficult because there's more adherence?
Yes, possibly. Probably all adheres anyway. Like, I can say for sure that you know when someone's already been in. Like, we do it to reduce the seroma formation. It's probably worth the difficulty of when you go back in.
Yep.
Think about it, it's all probably going to adhere down anyway.
Mm-hmm.
My guess is it probably doesn't make it harder.
But it does reduce the negative space, right?
Yeah. And a dog like this, you know, traumas aren't the end of the world, but can be avoided. Worth it.
What was it, seroma?
Traumas are
Is it fluid or something?
bloody serous type fluid that accumulates.
In the dead space?
Yeah. Yeah.
Put some food in the fridge.
Who for?
Are you recording?
Yes. Then what for then? What for then?
Nanny.
Ah, yeah. I just won.
Yeah.
Easy. You just tell Shamo that he's got to do it by the end of the day. That was the false smiles I've ever seen it.
Cameron's just already doing another 3 jobs
Is he?
today. Called him that no one else can get to.
Good on him. I'll get it done by the end of the day, that's easy.
It's just a big leg count, I can always do it as well.
Yeah, you've been doing a bloody good job there. You're doing a few of those.
Look at Nathan stepping up to the plate.
Yeah.
It's good practice because I only did it this year, so
Yeah.
reinforcing it's always a good thing to do.
Isn't it?
Done a bloody good job.
Well, this one's a dog, different.
Oh, so just, it's not even a count, is it? It's just a,
And
are
ideally
they there
using,
or not?
yeah, ideally using nothing, isn't it?
Yeah.
Yeah.
Well, I mean, ideally using nothing at all of them, but
Do you get like whipworm and stuff around here, or?
Yes, we definitely do. Majority is hookworm.
Whipworm?
That's the most common thing we see. This would be a greyhound. Greyhounds,